Hello, everyone. Welcome to our webinar on Office Operations Quick Hits. My name is Emily Whitcomb. I'm a director here at the National Safety Council. We're really excited to do this webinar today to talk about some of the quick hit items that we have released in regards to reopening office operations. And we have an exciting guest here for us to talk about how he is opening office operations for USG. Justin Dugas is going to share his story with us a little bit later. I want to start us off today just giving a quick thank you to our sponsors who really help make this possible. We have Avetta, ISN, McElhatton Foundation, and US Steel. Thank you all for your generous support for the SAFER effort. So let's flip over and look at our agenda for the day. We're going to kick it off by looking at a little bit of background of what some of the guidance has been so far out of the SAFER initiative for safe return to work, talk about the framework, the playbooks a little bit, and then I'm going to walk through the quick hit items that we have currently available for the office operations. I'm going to hand it over to Justin at that point, and he's going to tell you his story about how USG Corporation is doing their office reopening. And then I will close us out by sharing some SAFER resources. So this is the third webinar in our 5-part webinar series for this week. And these webinars are really just designed to share the SAFER quick hit items and give this short case study from one of our task force members. We're not going to be doing verbal Q&A today just because of the length of time of this webinar, but you are welcome to enter questions into either the chat box or the Q&A box. And we have some people on the line that are going to help triage and answer your questions. If you're not able to use those features or you want to send us an email, feel free to email us at safer@nsc.org. And I'll be putting my email as well as Justin's email at the end of the presentation. When you're using that chat feature, the Q&A feature, you may have to click a down arrow on a question to see if somebody on the NSC side has responded to that. Just a little troubleshooting feature that we have noticed this week with this webinar series. So to get us started, a little bit of background on what the SAFER initiative has been up to. One of the first pieces that we pushed out was our framework document. And these were recommendations that came from our task force members that looked at 6 different topic areas: physical facilities, medical health, stress, emotional and mental health, employment, legal and HR, communication, and external factors. We also looked at 4 operations types: office, closed industrial, open industrial, and public. So that was our overarching framework document, but we also created some playbooks that dug into each of these areas more specifically. So I'll show you an example of what one of the playbooks looks like. And I just happen to have an example of the office operations playbooks. So basically what this did was took the larger framework document, but zeroed in on the office operation recommendations specifically. We also added some more context to that. Again, these recommendations came from our task force members. So our industry professionals, our safety professionals, they're in the field dealing with this issue right now. So a big shout out to them for donating their time and expertise on this. All of these documents, there's 10 of them in total, are available for free at nsc.org/SAFER. So if you have not seen them, go ahead and check that out. And I'll share with you at the end of the presentation some other resources that we have available. But in this webinar series this week, we're going to be discussing the quick hits. And specifically today, we'll look at the office operations. All of the quick hit resources are free up on the website. You can navigate to it, again, if you go to SAFER, nsc.org/SAFER. These items were developed with the expertise of our task force members. There's 9 items total available. We are holding a webinar for each one of these. We're trying to make sure that we are able to walk through them and give you all a case study of how one of our task force members is utilizing these types of resources. So today, obviously, we're talking about office operations. Before I move on, I forgot to mention, if you are interested in the PowerPoint decks or the recordings, we will have them available at the end of the week. We want to wait till we get the whole series completed, and then we'll be sending them out to participants. They'll also be available on our website. So let's dig into today's quick hit items, which is, again, for the office operations. We're going to be looking at 3 of the quick hits that are related to office operations. The first one is office reopening. We'll look at the office physical distancing document. And then the third one is the risk exposure index for office settings. So let's start with office reopening. This is what the full document looks like. There's a few sections to it. The first one is 6 essential steps for reopening that you should consider: preparing the workforce, controlling access, creating physical distancing plan, reduce touch points and increase cleaning, and communicate for confidence. The second section here is how to prepare the workforce for reopening. Some of the items to consider here: entrances, reception, your signage, your PPE. This document also has a phased approach to reopening, which is really, I think, kind of the meat of this. And Justin's going to be talking in a little bit about how they are doing this phased approach. But it has 4 suggested phases on here, along with the timing and the percentage of your employees that you should consider bringing back throughout these phases. So check out this office reopening document. It's really fantastic. Again, this was content that was donated from our advisory council. And we are really grateful to have Justin here today to talk specifically about how they're doing their phased approach. If we flip over to our next document, this one is about physical distancing, how to put these practices into place, how to plan for it. We also have some really great photos. Morgan, if you want to flip over to, I think it's on the next slide. Yeah, we have some really great examples that were donated from our task force of how you can implement some of these protocols, great visual cues or reminders for employees, since physical distancing is not something that comes natural to us or something that we're used to doing. The final document here is our risk exposure index. Again, this was donated from one of our task force members, so we're really grateful for this knowledge. And this really serves as a guidance for the office setting. It takes into account 3 categories: so location, interaction, and task. And so you'll score each of those. And then if you want to flip to the next one, depending on your score, you're going to get assigned kind of a risk level: basic, simple, or complex. So this can really help you identify the risk exposure related to COVID in your office environment. So check out all of those office environment quick hits are up on the website for free, as long as the other quick hit items at nsc.org/safer. So next, I'd like to introduce our guest speaker for today. Justin Dugas is Senior Director of Safety and HR Operations for USG Corporation, the National Safety Council's 2016 Campbell Award winner. USG mines gypsum rock, which they use in the manufacture of a wide variety of building products, with well-known names such as sheetrock, dew rock, and fiber rock. Justin is a certified safety professional and is responsible for occupational and product safety for the corporation, leading a field team of safety and HR business partners who support the HR and safety needs of USG's 50 manufacturing facilities across North America. As a supplier to the construction industry, USG's manufacturing operations were deemed essential business and have operated throughout the pandemic. Employees of USG's corporate office in downtown Chicago, Mississauga, and Mexico City have been working remotely since mid-March. And Justin has teamed with the company's facilities manager to develop a comprehensive return to the office playbook, which he's going to share highlights with us today. So Justin, I'm going to go ahead and hand it over to you.
Thanks, Emily. I appreciate it. And thanks to the National Safety Council for creating the Safer Task Force and providing us with all this valuable information. We've certainly enjoyed contributing to this effort. Next slide, Morgan. So we're in the process of reopening our corporate office in downtown Chicago. We've reopened our office in Mississauga to a limited number of individuals, and we're going to be reopening our offices in Mexico City as well as the government allows. We have plans in place to do that. We have a research facility in Libertyville, Illinois that is essentially fully reopened. Some guiding principles that we've followed in terms of creating our plan, obviously keeping health and safety first, in everything that we do. Safety is a core value in our organization, and as it is in probably every organization who's taken the time to dial into this call. And so that's been our first priority. We're leveraging best practices for our manufacturing organization. As Emily mentioned, as an essential business, our plants have been operating throughout the pandemic, and we've learned a lot along the way. So there are many ideas and helpful tools and processes that our manufacturing team have been able to put together that we've been able to adopt or incorporate into our office reopening plans. We're utilizing a phased approach. As Emily showed you in that earlier graphic, we're doing something very similar in that we're taking a minimal measured and we're recognizing that it needs to be modifiable. Minimal in terms of the percentage of individuals that are going to be coming back at any point in time, measured in terms of the fact that it's going to happen over the course of an extended period of time, and obviously modifiable in that we're going to have to adjust to whatever the conditions we're dealt with. Working from home is working well for most everyone within our organization. We switched to working from home essentially overnight in early March, and I think the vast majority of our employees would say that we've not skipped a beat. And our senior leadership team would say the same thing. So we have to take that fact and balance, what's the rationale for coming back to work in the same facility together. And we need to be flexible to individuals' unique challenges, because we face many challenges associated with COVID-19, whether that be childcare or personal health situations, or just concerns about, the idea of coming back into a space with a bunch of other people. So some of the practices or some of the things that our plants have been doing that have worked well around self-assessment and temperature monitoring, social distancing, visual cues, occupancy signage around conference rooms and shared space. We've come up with, means of conducting our pre-shift safety huddles and stretching from a distance, COVID-assigned cleaning teams, so on and so forth. Many of these things we're incorporating into our plans, as I mentioned. Next slide, please. So this is several slides that we're going to be sharing with our teams through a WebEx meeting that is scheduled to be held over the course of the next couple of weeks, actually starting this week and then next week. But first thing we wanted to do is acknowledge, kind of working from home works for most people. There are some pros there's some pros and cons to working from home, and there's some pros and cons to working from the office as well. Obviously, having a flexible schedule, not needing to commute from anywhere further than your bedroom to the dining room table is pretty nice, and it saves you money and, more time with your family. Keeping a regular schedule is a challenge oftentimes when you're working from home, for some people at least. Lack of certain computer peripherals, printers, scanners, extra monitors and so on. Some folks have indicated that they've got Wi-Fi challenges. And the missing connection with coworkers. Obviously, we're not able to collaborate together with one another, so that's a challenge. But we've found ways to virtually collaborate that have really helped us to fill that void in many respects. And then there's advantages to working from the office. I won't go through those. Some of the reasons why we, have suggested that folks might need to return is we have certain processes and programs that have essentially been suspended or kind of been nurtured along remotely, but aren't functioning fully and need to be tended to. And so there are a handful of individuals that might need to go in to deal with those processes and programs. We've had some secondary help kind of keeping them up and going, but there's a need for staff to go in and check on them. Some folks have found working from home to be a challenge. It's good for most people, but not for everyone. You know, some people have space constraints, have kids that, you know, distract them and our pets and so on and so forth. Some folks don't have access to equipment that they would otherwise need or find to help them in their performance of their duties, such as, you know, printers, scanners, additional monitors, so on and so forth. So anyway, those were a few of the things that we wanted to line out as to why folks might have an interest in coming back. And the last one is intended to just be lighthearted around checking up on plants. We've actually had folks that have been very concerned about the plants that they left behind and whether we were watering them. So we started a health assessment program very early on, and actually we were self-assessing before we went to remote work, early March timeframe. And it's going to be important that we continue to do that. Our plants have all continued to do that throughout, and that self-assessment is occur before an individual leaves their home. We have a unique situation in our corporate office in Chicago in that about 95% of our employees come into the office over public transit through the Metro or CTA. And so giving them the confidence that the Metro or CTA are going to be safe modes of transit is one of the hurdles that we have to overcome. Some folks might choose to drive, and so we're providing them with information regarding, you know, commute alternatives as well. As it relates to parking and so on around our facility. But I'll get into our phased approach in just a minute. We expect that there'll be very few individuals that join us in the building in the short term at least. Next slide, please. So here's our phased approach. We're actually reopening the doors of our corporate office July 20th. And the percentages that are listed here are intended to communicate the building's capacity and not intended to communicate what percentage of employees might be returning at any given phase. And you can see here we've not listed dates for phase 3, or phase 2, 3, and 4 because we really don't know what to expect. At first, it's going to be essentially employees only and those approved contractors who are necessary in order to maintain the functions of the building. The janitorial staff, for example, our mailroom staff, and so on and so forth. As we move through the phases, we'll increasingly allow additional employees to return. At this point, we expect that we'll be working largely remotely or largely from home as it relates to our corporate offices in Chicago through the balance of the year, unless there's some vaccine that comes to be or a effective treatment regimen that is created that might result in us changing our plans or adjusting our plans. Next slide, please. So here are some of the precautions that we've taken within the office space itself. We've got antiseptic covers over elevator buttons, door handles, so on and so forth. We've got foot-operated door opening devices for our bathrooms. We've already had touchless and automatic fixtures in our restrooms as it relates to soap dispensing and water and so on. In our cafeteria, we're not resuming cafeteria operations over the short term. Whenever we do, it's going to be to-go only, and then we'll eventually resume a more normal cafeteria operation schedule. We're limiting hours within the building from 5 a.m. to 5 p.m. Monday through Friday. We're not allowing folks in on the weekend so that we can make sure that cleaning happens as it's scheduled to, and that spaces aren't reoccupied after they've been cleaned until the next day at least. We've done extensive review of our building ventilation systems to ensure that they've been appropriately adjusted to accommodate fresh air intake, and the filters have been changed. We've flushed our domestic water supplies throughout this process, and we've worked to conserve energy while we've been away, and that we've not run the HVAC to its normal levels, and we've not obviously had lights on, so as to save energy while we've not been occupying our building. So whenever folks enter the building, they're going to need to wear a mask, and we've got a schematic down at the bottom there that shows where they'll stand, and there'll be visual cues on the floor that basically usher people through the lobby space. It's a high-rise building, and so all of our employees occupy the 11th through 18th floor of our building, so everybody's got to take an elevator up unless you're ambitious and want to take the stairs. But Elevator capacity is going to be limited to 4 people, and there'll be 2 elevators running up and 2 elevators running down, except for during the morning and evening rushes. But once again, it's likely not going to be a rush, and that we'll have very few people returning in the near term. Temperature screening is definitely part of our process. We have a touchless automated temperature screening tool that we use. We have hand sanitizers in the lobby immediately after you walk into the building, as well as you exit the elevators, there are hand sanitizer stations. Exit the elevators as well as exiting the stairwells. Once you've reached your floor, mask use will be required whenever you're in any common areas. We have West End pantries where there are employee convenience centers, basically where there's coffee stations and water and so on and so forth. Those are going to remain open. We're going to ask folks to use disposable cups. And to wipe surfaces, there'll be disinfectant wipes and sprays and so on for employee use. Conference room capacity has been limited throughout the building, and those have been updated within our conference room registering systems. Chairs have been marked to indicate where people can sit and not sit. Cleaning supplies have been provided to every employee at their desk station as well as in common areas. We're asking folks to kind of confine themselves to use the equipment that's nearest them, including print devices, and avoid kind of traversing across multiple floors unnecessarily within our space, rather stay within your space. Stairwells have been designated as, one way for purposes of non-emergency travel. We have an east and west stairwell. The east stairwell has been designated as up, and the west stairwell has been designated as down. We're encouraging people to use the stairwells when, not rising up to the floor that they sit on, but rather just carrying themselves between floors. A lot of the lunch options that we had available in and around the office are closed as a result of the lack of tenant occupancy within the commercial space around our building. And so we want to make sure that folks are prepared to provide themselves their own meals and have the necessary utensils in order to eat it. We have a couple building amenities that are closed, as you would expect, the fitness center and a lounge area. We've increased bike storage capacity for folks that might choose to bike into work. Obviously, from a general precaution standpoint, social distancing is going to be required. Mask use anytime you're away from your desk or within 6 feet of anyone. No handshaking and so on. Hand washing will be encouraged frequently and thoroughly. Avoid touching surfaces, unnecessarily and potentially contaminated articles, and staying within your space. Next slide, please. So we've got a number of communications that we've planned, the WebEx sessions that I mentioned to you that are starting this week and then again next to overview these protocols. Each manager is going to reach out to their employees and they should already know, but they'll just discuss whether there's a particular need for them to come into the office. I expect that most people will say no, but there will be a handful of people that will say yes to collect things or to, as I mentioned, carry out critical functions that have kind of been on pause. And our leadership team, which are our CEO reports essentially, are going to manage the percentages that we've specified. And we're encouraging our managers to really be flexible towards individuals' concerns, their unique situations, whether that be childcare, personal health conditions, individuals in their family or in their household that might have compromised immune systems or particularly sensitive to, this disease. And we are going to be flexible. We are not requiring anyone to return to work. This is a voluntary program as it relates to our corporate offices in particular. And we have a playbook that we've developed. It's 20 plus pages, essentially covering a lot of the material that I reviewed with you. Each employee will receive a copy of it, and it's got a Q&A section in the back as well that'll be continuously updated as new questions arise. Next slide. Turn it back over to Emily. Thank you.
Thanks, Justin. Is there anything else that you wanted to add in there before I close this out with additional resources?
Nothing to add. Thank you.
All right, thank you. We have a few questions in the chat that we are working on answering. The chat function and the Q&A function is a little bit confusing for everyone, so I apologize for that. We will try and get your questions answered here. So in the last 5 minutes, I just wanted to share some of the SAFER resources that we have available up on the website, nsc.org/SAFER. And I will tell you, the team and the task force has been working really hard to get resources out there. So the first thing I want to point out here is in the middle, bottom right, the SAFER Playbooks. That's where you can find all the playbooks that I discussed earlier today that built off the framework. Those 10 topic areas and the operations types are under there. On the left-hand side, this is actually a new resource that we just finished, the Organizational Vulnerability Assessment. And Morgan, if you want to flip over, I can show you all what this looks like. We're really excited about this because we put out the framework and the playbook documents, which were laundry lists of recommendations that were compiled and really crowdsourced from our task force members. But there was a lot of recommendations, something like 200 of them. And we wanted a way to allow employers to interact with those recommendations without being overwhelmed. So what we did is create an online kind of a risk assessment where you could go in, answer some questions, and then it will give you the recommendations in a more tailored profile. So when you complete this assessment, which is entirely free, you'll get a vulnerability risk score. You'll get a list of potential control measures that you may still need to implement at your organizations. And then you'll get a control implementation completion summary by risk factor. So we're really excited for this tool. This was largely led by our own Amy Harper. So big shout out to her. Thank you for that. Morgan, if you want to flip to the next slide, this is some of the other resources that we have up on our website. And I wanted to quickly walk through them because there is so much information on the website. It really is fantastic. Up here on the top left, we have our SAFER Solutions directory. And this is providers that are offering products and services that could be helpful to you all during this pandemic. In the middle top up here, new, the SAFER collection. This is really a resource library of content that was donated to us. It's a searchable resource. If you can go in and type in keywords, you can see new items. This is updated every day as organizations and as companies donate content to us or as we're developing content. So go check out that library if you haven't yet. Take Action is where all of our quick hits lie, the ones we talked about today, the ones we've talked about earlier this week, and the ones that we'll talk about on Thursday and Friday. We also have posters for sale. We have a ton of resources specifically for our members on here. In that middle box, as well as the bottom left box, you can find tip sheets and presentations. Those are really resources that have been put together previously, such as on fatigue, or on opioid misuse that could be really helpful during this hard time for everyone. On the bottom right, employee well-being, this is a lot of resources about mental health, which we had a webinar on stress and mental health yesterday, and it was very well attended. It's obviously a topic area that you all are interested in, so go ahead and check out those resources as well. The last thing I wanted to point out is a webinar that we're bringing back. A few weeks ago, we had a SAFER Return webinar that was very, very popular. So we thought we would bring it back again. We're going to hold it July 15th at 11 a.m. with our own Catherine Mendoza and Anthony Washburn. They're going to walk through the SAFER framework and how to create a plan for a safe return to full operations. If you register for the webinar, you're going to receive a free copy of the Return to Workplace Playbook, which is a more detailed playbook than we have available up on the website that can really help you customize your own plan. So check that out at nsc.org/SAFER. So we have about 1 minute left. We're going to make sure we get all of your questions answered in the chat before we sign off here. But you are also welcome to email us. You can email me directly at emily.whitcomb@nsc.org. If you have any questions for Justin, he'd love to hear from you as well. Go ahead and shoot him an email. And then if you have anything related to SAFER, you can always email us at safer@nsc.org. So thank you all. I hope you join us tomorrow for our quick hit webinar on employee return to work status and confirmed case protocol. Our guest is going to be Tony Militello, who's the Director, Occupational Safety and Health for the Navy. So we're really excited about our webinar tomorrow. So see you all then. Have a good rest of your day.